Welcome to Dixie Regional Medical Center. COVID has had a tremendous impact on our community, and it's had a tremendous impact on our hospital, our caregivers, and our physicians. My name is Mitch Cloward. I'm the administrator of the hospital. We're excited to give you an inside look on exactly how COVID has impacted our hospital. Please join us for a tour.
One of the most common questions that we get is, should I come to the emergency department, and is it safe to come to the emergency department? And it's a very good question. First of all, just having symptoms of the infection is not a reason to come to the emergency department. If you're having minor symptoms and you feel like you're doing okay, that's appropriate. You can get tested as an outpatient and manage this at home. If you're having trouble breathing, if you're feeling very ill, then yes, you need to come to the emergency department, and this is a safe place to receive care. The thing that's different about this infection than the others is that we have no immunization at this point. People haven't been sick with it in the past, and so everybody can get sick. Are you going to get it if you get around somebody who has it? If you use appropriate precautions, you can be safe.
COVID's a big deal. If you or me and you get to watch somebody that's starved for oxygen, can't breathe, it's horrible. I want the community to know we are here for you no matter what. Whether you've got COVID, whether you don't have COVID, we can take care of you. We're a safe place.
Let's go take a look at the tent that we've set up and understand a little bit about the different care that we provide in the hospital. There's 3 levels of care when we're in a pandemic that we think about. Those levels are conventional care, contingency care, and crisis care. When we talk about conventional care, really what it is that we're talking about is the normal care that's provided at the hospital. When we start seeing additional patients beyond what we're normally able to take care of, we transition from conventional care into contingency care. And contingency care is the phase that we have been in during this pandemic. The final level of care that we talk about is crisis care. When we get into a crisis care situation, this is truly taking care of patients in a very non-standard way. This may be, instead of 3 or 4 patients for a nurse on a medical floor, or 1 or 2 patients in an ICU, this is a nurse taking care of many more patients than that. You can imagine that they're not able to provide the same level of care if they're taking care of many more patients. And it's not what we want to be. You can see here we've set up a tent in order to have additional beds. And we don't want to use this space. We can if we need to. We will if we need to. We're prepared to take care of all patients in Southwest Utah. But we would like to stay as far away from crisis care as we're able to stay. We won't be seeing people running back and forth. You won't see chaos, because that's not how we operate in a hospital setting. Let's stay away from crisis care, and you can help us stay away from crisis care by following what the governor has asked us to do, by wearing your mask, by socially distancing, and by staying away from people that are sick and when you're sick.
Welcome to our COVID unit. This previously was our 32-bed orthopedic spine unit, which in the recent months we've converted to being just COVID. We are a 32-bed unit that is completely full at this time, caring for our COVID population. I'm going to share with you one of our nurses that's going to go through and don all of the PPE that we're required to wear each and every time we go into a patient's room. This is extremely time-consuming, physically exhausting. Caring for the COVID patients is emotionally exhausting. We are their only person that they have contact with during their hospitalization. So not only are we their care provider, but we also are their emotional support on a daily basis. So Mikkel's going to go through and don and doff a PPE. Now we are going to put on our gown, which will be worn the entire time that she's in the room, and these become extremely hot.
It's very time consuming. It takes away from patient care. I have to condense care. 1, because this is super hot, and 2, because I have less time in my day. It becomes exhausting as I wash my hands and need continuous hand sanitizer and lotion because my hands are breaking down, and in order to even get into a room, you're looking at least 30 seconds in sometimes life-saving events where we're all having to don this and hope that we get in there fast enough.
Mikkel usually dons this type of PPE at least 75 times a day. I would say that's at a minimum. They care for 5 patients, 4 or 5 patients, and go in an average of probably at least 4 or 5 times an hour. So After a 12-hour shift, that's a pretty extensive amount of time spent in this PPE that they're wearing. So she'll take this off a certain way to make sure that all of the germs that she's been in touch with are still on the inside. And again, this would be done in the room, not outside.
The patients here in the intensive care unit are only the sickest of the sick. Their length of stay or the time that they spend here in the hospital is oftentimes much longer than a typical hospitalization would be. If you walk down this hallway here, we've got a lot of supplies on the side of the hallway. These are the personal protective equipment that we use. Some of these patients require high flow nasal cannula, which is a really high amount of oxygen flow. And if that comes out of their nose for even a couple of moments, their oxygen level can decline so rapidly that we have only a matter of seconds to minutes to get them back into where the oxygen needs to flow. And that puts a lot of strain and pressure on the respiratory therapists who are trying to get in there quickly to save the patient's life. So you can see that the nurses need to spend time working with the patient to position them so they avoid bed sores. They have to rotate them every 2 hours. The patient's oxygen levels are better when they're on their belly, which is why we have the patients on their belly in some cases.
So I'm a respiratory therapist for 15 years. And this has been one of the most overwhelming times for all of us.
It's just the little things that make a huge difference. By not washing your hands even one time, you can potentially change someone's life forever. People die every day. And it's all preventable, all of it.
I know at this time in life, sometimes we feel like everybody's trying to control us and tell us what to do. It doesn't hurt anything to wear a cloth in your face. I know personally, working here and wearing one all day, every day has helped me, or we will all be sick.
There was a patient that was passing away from COVID, and she didn't have any family. So me and 2 other nurses just sat in the room with her while she passed away. And we all just kind of held each other's hands.
But then as I left the room and walked down the hallway, I found the patient's nurse and I said, "Can you go for a walk with me?" And we went into the stairwell. I broke down and I just said, "How do you do this? How do you keep caring for these patients day after day?" Watching them die. And I needed that break. I needed that nurse who was my hero that day. And I'm so grateful for the team that we have here that allows us to keep caring for patients despite the circumstances that we're in.
We've had several couples come into the hospital with COVID-19, and most of the time only one of them makes it out. It's awful, and you have the power to prevent all of that.
Every day we call our patients' families because they're not all able to be here with their loved ones, and we give them an update on their conditions. Regularly, their family members give us sincere gratitude and thanks. We appreciate that gratitude, we appreciate that thanks, and we feel it. We feel that benefit. Will you help us? Will you please do all that you can to stay safe? Keep your mask on. Stay socially distant apart while still expressing love for one another. Get your flu shot. Stay home when you're sick. And please, do your best to help us all as we work through this, but most importantly, to help these patients who are here suffering. That would be the best thank you that we could appreciate. Thank you.